Hi, I'm Tracy Brown, the CEO of the American Diabetes Association.
Hi, I'm Mary DeGroot. I'm the 2020 President of Healthcare and Education for the American Diabetes Association. I'm an associate professor at Indiana University School of Medicine and a clinical health psychologist.
And we are very excited about spending some time with Dr. DeGroot today. As always, we are trying to bring you the latest, the greatest, up-to-date information and most useful and helpful information. And we're going to spend some time today talking to Dr. DeGroot about mental health and mental well-being. And so the question we have for you today, Dr. DeGroot, is as we just think about this COVID-19 crisis and just the unbelievable job that our frontline healthcare professionals are going through right now. I mean, it is almost mind-boggling to understand the amount of work and care that they are delivering. And we can only imagine they're dealing with a lot. As a healthcare professional, what advice do you have for them to maintain, good mental well-being?
Yeah, you're absolutely right. This is an unprecedented time for all of us, and particularly in healthcare. In my own environment, I've always been impressed with my colleagues, and in the last week, I've been even more impressed than I was already because of the extraordinary pivot that so many healthcare organizations and providers have made to adapt to the requirements that we have to keep people safe during this pandemic. And we tend to think about that in terms of emergency room care, which is most certainly being taxed so heavily right now in many parts of the country. But that's also true at the outpatient level, and the ways in which many healthcare systems are using, sometimes for the very first time, alternate ways of providing care, whether that's through virtual visits, video kinds of interfaces, or telephone-based care. So there are a number of things that we need to be mindful of as healthcare providers. The first is that the golden rule of helping is that we can't help someone else until we've helped ourselves. And so tuning into how we're doing physically in terms of fatigue, in terms of our emotions is very important. It's okay not to be okay right now. It's okay to feel overwhelmed because what's happening right now is in fact overwhelming. A second key point is to know that as healthcare providers, we are pretty resilient people. We went into this business because we wanted to help. We're still committed to that more than ever, perhaps. And we have a toolkit that we can use to help ourselves get through this. That toolkit's going to be taxed, and we need to be mindful of actively recharging our emotional batteries when we can take breaks. And taking breaks are very important, whether that's 5 seconds to draw in a cleansing breath, or whether that's overnight, or whether that's a weekend, depending on the type of care that we're providing. I think it's also really important for us to recognize that our patients are having the same kinds of feelings that we are. And so recognizing that they're dealing with, just as we may be dealing with, unfamiliar technology or unfamiliar workflows. They have their own fears about vulnerabilities, just as we do. We're concerned about our vulnerabilities. And unlike our patients, we're in a position to be able to take some steps to mitigate some of those fears. So mindful that our patients are experiencing many of those same feelings. And also that our patients may be experiencing some miscarried helping too. People who have ideas about how to help, but that may or may not be on target with what they might need or what we might recommend. So really being connected to how we're feeling, and also then taking these active steps to care for ourselves. And it's all of the simple things that we know. It's getting as much sleep as we can that's healthy for us. It's getting good nutrition. It's taking the breaks. It's checking in with our loved ones. And also explaining to them that when we can't be with them because we need to be on call or we need to be providing care, that we will come back, that we will be there for them again, but that this is a time where we need their support for the work that we're doing.
That's fantastic. And just want to say thank you, Dr. DeGroot, for sharing those strategies and recommendations of things to do. And to all of the healthcare professionals out there, we are so grateful and thankful for everything that you're doing. Please know that you are in our thoughts and prayers as you are helping care for hundreds and thousands of people. Thank you, and thank you, Dr. DeGroot, for being with us.
My pleasure.